Hi, my name is Vivian Harper Millan, and this is my presentation over my internship this summer, and it was with DFW Oral and Facial Surgical Arts over at Grand Prairie, Texas. So how did I get started with this internship? It first started with selecting the location, and in my case, I asked a surgeon that my stepmom actually works for, and he is a surgeon at an independent practice, which means he owns the business. It is his business completely. He is his own boss. He makes his own hours and all of that. So it was completely up to him, and it worked out really well that I didn't have to go through corporate or any other managers to get approval through the location itself. After I got approval with the location, I had to take the second step of getting approval through the campus. So I had to set up a meeting with Dr. Taylor and tell him about the internship and seek the approval through the KWU paperwork. And I submitted all of this paperwork prior to the summer so that the school and the surgeon were both aware of my hours, what I was going to be doing, and where I was going to be. So the final step after getting all of that approved through both the surgeon and the school, the final step was setting up a schedule, and that is just basically figuring out when I was going to be going in to get my hours, and that way the school was aware of when I was going to be there, and the surgeon was also aware so that I could log these hours for my internship. So next we're going to get into the who, what, when, and where I did all of these internship activities. So this is the overview of what I was actually doing. So who I worked with, I mostly worked with Dr. Taylor. He was my site supervisor. Like I said before, this is his independent practice. I got this picture off of his website. This is an introduction of who he is and how he got his education and how he's started up his business and where he is at now. I also worked with 4 different assistants at his location. On his website, it shows all of the assistants that are at his office. However, I mostly only worked with 4 of them, and that was assistants Alex, Sarah, Ariana, and there's another Sarah that I worked with, and I worked with all of them. And then there was 2 managers that were at this location, and it was Tracy and Tiffany. So these were the 2 people that I would go to prior to asking Dr. Taylor for anything. So if I needed any help, I would first ask Alex, Sarah, or Ariana, which is one of the assistants, because Dr. Taylor he is the boss, like I said, so he is over everything. And if I had a question, it wouldn't make any sense to bother him in his day, and I would ask somebody else before asking him. But I worked with multiple patients every single day. We had at least 6 surgeries in the morning and then 20 patients in the afternoon. So what I did varied drastically. It started off really, really slow because I had to train and figure out what I could do so that I wasn't out of my scope of practice and that I wasn't detrimenting any of the work that not the hospital, but the office was doing. So first I began with some system training, which is all online work, just learning how to use the computers, surgical scanning, sterilization, surgical prep and takedown. I learned how to take some x-rays, CTs, PAs, and TMJs, and all of those are just images, 2D or 3D images that we use prior to the surgery so that Dr. Taylor can get a surgical guide for what he is going or planning to do. I learned how to schedule appointments. I learned how to review some of the referrals that are sent over to the office, and with that is either determining what you're going to be setting them up for at our location or sending them off to a different location where they can have their case processed. I learned how to take impressions, set up surgical trays, and with the trays, there are multiple different trays that you learn how to do. There's biopsy trays, extraction trays, implant trays, and many more, and that was probably one of the hardest things I learned how to do, only because it was so time consuming and there's so many different ones, and each one is not like the other. Every single one is very specific and it requires its own instruments. I also learned how to take measurements over implants and coloring. So this is learning how to measure the implant that the patient is going to need. So you order the right size, and then you also allow the patient to select what color of this implant they're going to want because they get to select the shade of porcelain that the implant is going to be. I also learned how to discharge patients. That was my favorite task that I learned how to do because it was the closest thing to a nursing job, and that is what I plan on doing after this. I learned how to place orders for the office, which is just going hand in hand with the next thing, which is restocking the rooms. This is just making sure all of the instruments are up to date and making sure everything is in the room for Dr. Taylor for what he needs during surgery or during his consultations. And finally, one of the last things I learned how to do was send off biopsies, which was one of the more tedious things I learned how to do, which is probably why it was the last. Some of these two photos that I have included are just examples of the work that I have done. So this is a photo of a biopsy tray. This shows none of the extraction tools on the tray because he's not doing an extraction, it's a biopsy. So this is a setup of what that tray would look like. This is a picture from the first time I learned how to do it. And the picture on the right is the sterilization machine. So that shows the instruments already bagged in there and how they would go. You put them face down and you put them in there for 35 minutes, you sterilize, you let them out and you cool, and you put them away properly in the utensils room. So for when my hours were, I would go in Monday through Friday because the office isn't open on the weekend, and the end time varied between 7:30 in the morning or 8 in the morning. It just depended on when surgeries were scheduled, but most of the time you want to be there 30 minutes before Dr. Taylor's there so you have enough time to set up for surgery and for the day. So most of the time I was going in at 7:30, but the surgeries wouldn't start until 8 or 8:30. My out time varied anywhere between 4 to 5. This only didn't go for on Fridays. It would vary drastically within that hour depending on how consultations or surgeries went during the day would determine how the rest of the day would go. There was only 1 week that I didn't go in to get my hours, and it was a full week that I didn't go in, and he gave me some vacation time. And Fridays were the only surgical days, so we normally would work through the hour that is cut out for lunch, and we would just do surgeries all day until we leave about 1 p.m. So the office is technically closed to the public by 12, but we wouldn't leave anywhere between 1 to 2. So this is the location that I was at. It was at DFW Oral and Facial Surgical Arts. This is in Grand Prairie, Texas. It is only 20 minutes away from my house, which is really, really nice for me because I didn't want to have to go out of my way. And I provided the website of the office that I was at, and this is what the homepage looks like. And it also provides a picture of the front of the office on the homepage. So the next portion of what I want to get into during my internship were some of the challenges and the struggles that I faced, which were very few. Right here are the main 3 that I had to go through and how I actually overcame them. So the first one being that meeting the 350 hours within the course's time frame. This was the hardest thing for me only because I did take a week off from going into the office because we did agree on doing the daily hours. He did agree to give me some vacation time, which was really, really nice of him. And I asked for an extension through Kansas Wesleyan, so through my faculty advisor, I asked for an extension so that I could read the 7 credit hours for my internship to be completed. And there was no problem there as long as you go through the proper paperwork and you communicate. It had no problem on my grade or affected any of my internship work. The second challenge that I would say I had was memorizing each surgical tray setup. Like I said before, this was one of the hardest things that I had learned how to do only because it was very specific and you have to get each one right. And the only way that I was able to overcome this challenge was like going over it step by step repetitively. So repetitive practice was how I learned most of what I did at the office, but this one being the hardest thing that I did. And the third challenge that I had was just adjusting to the everyday schedule. I know that I was a college student, but my classes were always later in the day and I always had practice and you woke up at different times. It was never set day to day. And so this is a little bit different for me, although I did like getting into a routine. I just started waking up earlier and packing a lunch to make it through the day and loaded myself up on lots and lots of coffee. But I did find that this isn't really a challenge. This is just something that everybody in the office is actually going through, so I don't foresee this getting any better. But although those challenges were in place, here are this is some of what I learned, some of the takeaways from my internship. So lessons that I learned were efficient healthcare communication practices, which was my number one goal that I wanted to complete over my internship. And I really do feel like I accomplished this by being around other assistants and doctors that I really got to observe and pick up small tips and approaches from them. I also learned how to be efficient doing daily tasks such as like small work, what I would typically call busy work, in between assessing patients. So I can't just tend to the patients. That sounds crazy enough to say, but there's also other things that need to be done in the office, and there's never any really downtime. There's always something that you could be doing. And it's just a matter of finding the time to do it in between your other tasks. Something else I learned how to do was proper sterilization and cleaning methods, and this is not something that I had expected to learn how to do, but I'm glad that I did because I felt like I contributed largely to making the day move faster. I also learned good image capturing, which I find so amazing that I actually got to hands-on learn how to work with these machines and patients, so that when I learn how to do this in nursing school and medical school, that it helps me out in the future, so that I've already had prior practice. And the fifth one is system use and database entry. I was debating on if I wanted to put this on there because I don't know if I am proficient enough in this skill yet. However, I was quite bad when I entered into my internship, and I really got this task down. I told them I'm not tech savvy, and they really took the time to teach me everything that I needed to know, and it really helped me out throughout my 10 weeks there. So going into my career after this, although I do not intend on going into the field of surgical assisting particularly, I really enjoyed my time here along with everything else that I learned. I do intend on going back to school to become a nurse because that part of my job was absolutely my favorite, to have everyday interactions with patients. Before going to this location, I did know that I wanted to be a nurse, which is why I selected this type of internship, and I'm really happy that I did because it just solidified what I wanted to do in the future even more. And I am extremely grateful that I had this opportunity. That is all.